At Whittier Street Health Center, we are on a course of redefining community health. As an urban-focused healthcare provider, we recognize our responsibility to care for our neighbors. Whittier has become a familiar sight, one of positive change and a beacon of hope for underserved residents. Our vision to achieve a state of wellness within neighborhoods we serve is what makes Whittier unique. By addressing social and environmental disparities that limit our patients' potential, we are helping them to reach their personal best health and well-being. The individuals and families we serve face a disproportionate risk for major diseases and health complications. They also bear the burden of neighborhood violence, limited access to fresh foods, safe green spaces, employment, educational opportunities, and affordable housing. In response, we strive to offer services that meet the health and social needs of our patients and community residents and consider their lives through a lens that is wider than their disease condition.
The value of Whittier Street Health Center is undeniable. It recognizes that the city is mixed with an immigrant refugee population, and we need to serve them with people that look like them and speak their language.
With our proactive and whole health approach to delivering care, we are focused on ensuring our patients have a pleasant experience in an atmosphere that is open and welcoming.
Anything you could think of, they really put inside of this building, so it really made it easier and more accessible.
We are attending to our patients' whole health needs, physical and psychosocial, because we know that much of what goes into the healing process happens outside of our clinic walls.
This is the first time I've ever worked in a facility where I've never had to turn anybody away. Everyone is welcome and everybody gets served.
Our behavioral health team are key to our holistic approach to care and are trained professionals who recognize the heavy burdens of stress and addictions and its negative impact on the health of patients.
That was one of my biggest issues in my past with the drug abuse. So for me to open up to people is huge, and to tell people that's stuff that only I know. It means I trust these people a lot. They don't judge.
It's well documented that post-traumatic stress disorder and substance abuse are correlated. The street violence that this community sees causes the same kind of PTSD that Iraqi war veterans see.
Yeah, at Whittier, they teach you it's not just come in, get your medication, go out the door. The groups they hold here, they teach you how to interact with people. Now I get up, I go to work every day. I have a baby on the way. I have responsibilities. People trust me again. Honestly, if I didn't have Whittier Street, who knows where I would be right now.
In 2016, Whittier delivered care to thousands of community residents, many of whom suffer from more than one chronic illness. We provided close to 18,000 visits to patients who sought behavioral health counseling specifically to learn about and manage their chronic illnesses.
I was diagnosed to be pre-hypertensive and later pre-diabetes, that I was invited to come into this small group of people with diabetes.
Patients are educated about their condition and receive wellness strategies and support in our wellness center.
We discuss our experiences, my medications, and to look into the type of foods I eat too. With that, I think I'm getting better, and I want to appreciate Whittier for organizing such a group.
Our dental department continues to be one of our fastest growing departments, now also offering a wide range of oral health services to address the lack of access to oral health services, oral health diseases, and the impact on their physical health. In addition to expanded oral health services, we are addressing the high rates of preventable glaucoma, cataracts, and other eye diseases in minority patients. We also work hard to serve special populations and patients with infectious diseases. Roxbury has the second highest rate of HIV infection in the city and ranks in the top 5 neighborhoods for hepatitis B and C cases, with rates for all sexual transmitted diseases extremely high. The obstacles to healthcare for our low-income HIV and AIDS, LGBTQ, and other patients with infectious diseases are enormous. They often mistrust the traditional healthcare system and lack health insurance, and often need housing, employment, food, and transportation.
Since 1990, I became infected, and I've been living with HIV ever since. I come here because I'm also looking to build community and find support Right now, I'm part of a support group, and I enjoy it. I like my doctors. I enjoy my doctors, and I sit down and I have really great conversation with my doctors about my care, and the nurses and everyone in between.
A recent needs assessment survey of our elderly residents in public housing showed that many feel lonely and isolated due to unsafe neighborhoods and lack of transportation. This affects their ability to live active, healthy, independent lives and is a major risk factor for depression. Our Healthy at Any Age programs are connecting older adults and encouraging learning, socializing, and community building. Through our Falls Prevention program, patients are improving their strength and balance, while our wellness workshops include chair yoga and exercise, nutrition classes, and creative arts therapy programs.
I do art therapy. Thursdays, I do yoga. Friday, I have sewing class. And Saturdays, I do an ab class in the gym. And I see the primary care doctor as well. I love it over here. And my family teases me all the time. They say, "Where you going, home?" I said, "Where's home? Whittier Street Health Center?" They said, "Yes."
Another program for seniors, My Life, My Body, empowers patients diagnosed with one or more chronic conditions. Our program works with patients to create a plan to reduce the need for pain medication, improve nutrition, and deal with depression and stress that often accompanies and can lengthen the healing process.
The biggest barrier to having a good health for me was eating food the wrong way. I had gotten hit by a car in 2014, put me in a wheelchair for 11 months. And going to My Health and Body wellness class helped me change those things. It showed me ways that I didn't have to rely on other people.
Whittier is giving its young patients the tools to feed their bodies and minds and to prepare them for a lifetime of healthy choices. A big part of the program is teaching teens about good nutrition as they build self-esteem. Youth are also introduced to workshops to help them succeed academically and realize their full potential. The workshops and activities address a range of health and wellness topics.
We have workshops on different things, different topics like bullying and violence prevention. They train us so we can make workshops for other people in our communities.
So it's helped me with presentations and my pronunciation and eye contact with people. So I've gotten better at that. It's also helped me build trust with others.
Growing up in these high-risk communities, they face a lot of violence, drugs in their community. So we try to get them to a safe place, which is here, Whittier Street, where we could provide them with life skills and just try to prepare them for whatever comes their way.
I feel like I have become more responsible and more mature since coming to this program.
We are piloting a mindful living program for at-risk mothers-to-be that relies on integrative therapies such as mindfulness movement, meditation, and yoga to help them cope with stress and prepare for labor. In addition to preparing women for labor, our Centering Parenting and Centering Pregnancy programs teach mothers techniques for dealing with unplanned and anxiety-inducing events after birth. We give them the tools to help deal with life challenges, to appreciate the pleasant, and gain perspective on unpleasant events.
When I came to Centering and I felt all the love and support that was surrounded around having a pregnancy, I felt a little less like a statistic. I felt more like I was supported. I'm learning a lot of information that's based on exactly what I'm going through. I'm getting the support of the group, and I feel like I'm getting the support of the community.
Since men are less likely to seek medical attention, we are working hard to connect them to all forms of care, from primary care to support services, in an innovative and comprehensive way.
My primary care had seen something in my lungs that they thought, might have been cancerous. The not knowing is the hardest part, but they make you feel so comfortable in the process of trying to heal yourself.
Engaging them as active participants rather than passive recipients in their treatment, we are helping them to take care of themselves and to stay healthy.
Thank you for saving my life. Thank you.
A healthy diet, exercise, and weight control are critical elements of managing chronic conditions and stress, and our commitment to addressing these concerns can be seen in our new Community Garden and Fitness Center.
I love coming here to Whittier. I've been coming to the gym since the gym opened. I was 319. By me losing the weight, I'm not a diabetic anymore. Yay me.
Our nutritionists, health coaches, and certified personal trainers introduced more than 1,500 new patients and residents to the lifelong benefits of good nutrition and exercise.
I really enjoy having a personal trainer because it's like having someone who's like with me through this, so I'm not doing it alone, someone to like encourage me and motivate me.
I've seen improvement in my health and with both my doctor and working here in the gym with my trainer.
In 2016, with over 120,000 clinic visits, we touched the lives of more than 30,000 patients in our center and an additional 25,000 residents in the community. In October 2016, we expanded our medication therapy program and opened a new pharmacy on Blue Hill Avenue in North Dorchester. In May 2017, we will be opening a new clinic in the same location on Blue Hill Avenue in a senior housing building in North Dorchester to further increase our positive impact in vulnerable communities with limited access to transportation and healthcare. Through our focus on combining health with wellness and social supports, and together with our supporters and partners, we are moving closer to achieving equality in healthcare.
So many things are going on outside. So many people are being hurt, are hurting, and they're coming in here looking for a place, a sanctuary.
We will continue to provide high-quality holistic care and address barriers to healthcare and well-being, one person at a time.
Whittier is top of the line. From the guy that's at the front door to the person I work with one-on-one. Thank you. I wouldn't go anywhere else, so thank you.
Whittier Street Health Center is a life changer.
It's a great place, and I wouldn't give it up for the world.